It's time for this week's First Utah Business Spotlight.
All right, well, welcome, Kyle. Kyle Colby with Equation Consulting, and you're one of the founders of the company.
I am.
Right? So how long has your company been around? And maybe give us a little history about what you do and where you came from.
Great, yeah. There were 6 of us initially that started Equation Consulting back in 2006. We were part of another slightly larger healthcare consulting firm, and that firm was purchased by a large group, and we went from being a small boutique firm to being a small piece on the back, about a 40,000 person actually rehab care firm, and decided, let's try this by ourselves. And so the 6 of us broke off and pulled out a second mortgage on the home and funded it for about the first 4 months, and gratefully got some contracts pretty quickly, and we're off and running as a physician healthcare consulting firm.
That's great. So what is it that you do for your clients?
So our niche in healthcare is really the interplay or the interaction between doctors and hospitals or health systems. So many of our clients are hospitals or health systems that employ a lot of doctors. Today's healthcare environment, we have a lot of what we call alignment going on, where physicians and hospitals are coming together to provide healthcare. And in that process of coming together, there's often a lot of problems that health systems run into, and they find that they're losing a lot of money with their employed physician groups, and that's generally when we get the call to say, help. Well, what are we doing wrong? What can we improve? Why is this business not working for us?
And I imagine the margins are getting tighter and tighter for the healthcare industry.
Oh, absolutely. Reimbursements are falling. Whether you're talking the government payers or the private payers, everything's coming much tighter. Where we used to be able to run maybe a little fat and happy on parts of the business, that's gone away. And if you're not right on top of everything that's going on, you're going to be running in the red.
Okay, so explain the type of client that you have. Who do you work for?
Probably 90% of our clients are hospitals. You think of a community hospital type, maybe about 250 beds, maybe employ around...
Smaller hospitals.
Smaller hospitals.
Okay.
They employ anywhere from 100 to 250 doctors or so, and are generally, at least began losing money with those doctors and needed to know how to fix that issue. That's probably 90%. We do have several large clients, though. We do a lot of work for the medical school in New Jersey, which is the biggest medical school in the country. Yale School of Medicine and Yale Hospitals and Clinics is one of my clients. Texas Children's Hospital, probably the largest children's hospital in the country.
So you're all over the country then?
All over the country. In fact, I hate to say it, we probably haven't done work specifically for a Utah client in the last year or so, just how it's gone. So right now I spend most of my time in Texas, Ohio, and New Jersey.
Okay. How about outside of the country? Is it mainly just in the U.S.?
We've gotten questions about doing some things in England and a few other places, and I've told them I travel enough to not have to go across the pond, so we've kept it at least within the States.
Keeps you plenty busy, okay.
Yeah.
So what problems exactly is it that you're solving? I mean, we talked about, helping to address cutting costs, and what other issues do you look at?
Well, healthcare is a business just like any other business. You've got your revenue coming in and you've got your costs coming out, and it's understanding those things. However, if you've ever received an EOB from your doctor...
Explanation of benefits.
An explanation of benefits, yes. You'll look at that and likely be confused. And so the process of actually billing for services and collecting for services is much, much more complicated in the healthcare environment than it is in most businesses. So a lot of the work that we do is helping them through that very convoluted process to getting paid, analyzing are they being paid appropriately for services, and then helping them fix whatever issues they might have with the revenue cycle process.
Do you do negotiations then with the providers, between the providers and the payers?
Yeah, so we do come in and work in the negotiation process. We provide a lot of the analytic tools, and we'll also sit down in the negotiation process with the payers and the providers to build out those contracts. So that's one piece that we do. We actually have a product that we use with clients that we call an A10. It's the top 10 economic drivers of a physician practice. And that includes revenue cycle, physician productivity, staff costs, et cetera, a number of these things. And so when we do an analysis, we look across those 10 drivers and say, okay, here are the 5 that are causing you issues. Let's go after and fix those 5.
So do you identify, do you also help them fix those issues that you help identify?
Absolutely. So the first piece is to go in and say, okay, you've got a $2 million problem with physician productivity. The next step would be to go in and build the plan with the client on how they're going to fix that, how they can bring more patients into the practices, or how they can help the physicians from a workflow standpoint see more patients to increase the volume in the practices.
How do you bring more patients into a practice?
That's a great question. It really depends on why you don't have them in the practice. Sometimes a hospital will want to build a service line, say neurosurgery, and you have to have a certain number of doctors just to provide the coverage for the hospital. Sometimes they'll build that service line and there's really not enough patients in the market to support the physician side of that practice. And so what we do with our data is we put together the hospital side and the physician side, so we can say, okay, you need 3 doctors. Maybe you don't have the volume for 3 doctors, and so you're going to show a big red number at the bottom of your physician practice income statement. However, when we pull together all the economics of the downstream revenue into the hospital, neurosurgery makes sense. And so sometimes it's just helping them understand, you're making an investment here, there is a return on that investment over on the other side.
Gotcha. And so over time, they'll build that and focus in on that area.
Exactly.
Okay. So tell us about future plans for your company, for Equation.
Well, like a lot of folks in the healthcare space, we see the future of healthcare really relying more and more on good data and analytics. And that's either on the economic, the financial side of the equation, or on the clinical side. And so
When you say clinical, is that like patient care or?
patient data, so we think of an electronic medical record.
Right.
So it's collecting everything from what your cholesterol score is to what your height and weight statistics are to whether you're a smoker or not. And so we collect all this information in an EMR. And the future is taking that clinical data and the economic data and putting it together so that you can build processes around particular patient populations that provide better clinical outcomes, but also better economic outcomes. And so our focus over the last really several years has been building out a series of data tools that interface with all the transaction systems that a hospital will have, and provide them the analytics they need to make better informed decisions about the economic decisions they make, strategic planning, but also we get a little bit into patient care as well to show them these are patient pathways that are more effective than others.
Okay. And so obviously the Affordable Care Act has had a huge impact on healthcare and will in the future, but you touched on some of this, but are there other areas, direction of healthcare in general, where you see the industry going?
Absolutely, and the Affordable Care Act has had a big influence and will continue to have, whether it gets changed in the future or not. One of those, one of the impacts that it really has had is to create some sort of standards across healthcare, particularly in our environment, which is dealing with the data. And so, say 10 years ago, an electronic medical record could be anything. So if you went to one place, the EMR would look completely different than another place. And
So standardizing how that looks from healthcare provider to healthcare provider.
And what that enables the healthcare provider to do is to track a patient from one environment to the next environment and to transfer that patient's data. Managing that flow of information is becoming really, really important.
So an individual moves from one state to another state, then that transition isn't that difficult.
That's the goal. We're not there yet, but that is where we're looking for, to bring it so you can have that medical information follow you when you go to a different provider.
Or even one specialist to another specialist,
Absolutely.
how one impacts the other, I guess.
Absolutely,
Yeah.
sure.
Okay, cool. So starting a small business in Utah, what's that been like for you? You mentioned taking out a loan on the house and so forth. So our show is about helping small businesses to better manage their company and grow. And what are your thoughts as far as starting a company here in Utah?
Well, one, our experience in the state has been that there's a great pool of people, and that's been probably the thing that's led to our success as much as anything. We've had a very specific and regimented hiring practice, and we found great folks in this area. Like I said, I can't say we all did. I personally took out a second mortgage on my home to fund the business for the first 3 months or so, and then we were, lucky enough to pick up some contracts to move from there. But for us, it was once we hit a certain stage, once we got the first $1 million contract, what do we do with the business? How does the business then evolve beyond what it was? And we started with 6 partners, which was unwieldy to begin with.
Sure.
We've now brought it down to 3 partners, which has made that more workable. But for us, it was really just jumping off the cliff. I think lucky enough and fortunate enough that we did it at the right time in the right place, and it came together for us.
Great. Well, it's a great Utah success story. So, Kyle Kobe, we appreciate you being with us today on the show, and again with Equation Consulting, and headquartered up in Layton, Utah. Is that right? Okay.
Yes, we are.
So great to have you on our show. Appreciate it.
Great, appreciate it.